Alright guys, listen up. We've got a patient with irritation, cellulitis, and benign acute childhood myositis.
Sounds like an infection to me.
I agree. It might be Lyme disease or something similar.
Maybe, but I think it's a metabolic disorder.
Enough with your theories. It's mulibrainanism.
But Hawks.
Shut up and listen. I've studied this case for hours. A patient must undergo parathyroidectomy no matter the risk. It's the only way to heal them.
Parathyroidectomy? You can't be serious?
I'm dead goddamn serious. Now, let's not forget our job here is to follow my orders blindly.
Hawks, is this patient the same one who managed to wreck a sleigh out front?
What made you so observant, Sherlock? Is this shaking your faith a little?
Shaking my faith? In what, Santa Claus?
That's right.
This is that mall Santa you were using an excuse a few months ago.
Ladies and gentlemen, pay close attention to this conversation. Randall would really wish that we disappoint a bunch of children for the price of stroking his ego and diminishing the great work of an approachable, generous man, open to requests at the nearby mall. You're sick in the head. Everyone get the jolly back into Old St. Nick.
Well, Hawks, I'm glad you could make it. We need to discuss your recent request for a parathyroidectomy on your patient who you believe has mulibrainanism.
I came as fast as I could, boss.
Now, where did you get the idea for this procedure? This is quite unusual and risky, don't you think?
Well, it's from a famous Hollywood actor who played lots of doctors. They always seem to know what they're doing in the movies.
A Hollywood actor playing a doctor is hardly a reliable source, Hawks. We need to stick with proven medical practices and procedures.
But this actor has played so many different types of doctors in their films. They're bound to get it right.
The point here isn't about the number of roles an actor has had, but about the authenticity of the knowledge they have. We can't use them as a guide for real-life medical procedures.
But this actor was really convincing on screen, and he spent years convincing everyone he was not only qualified for the role, but knew the part in and out.
You won't even tell me who it is.
I'd rather not, because, according to your logic, you'd still be too arrogant in your own ways to compare your cute part-time education at some community college against a strong method actor who takes his work seriously.
I wouldn't care if it was Daniel fucking Day-Lewis, Hawks.
Exactly. You think you're better than him?
That's not the point I'm making!
Well, guess what? We have a miracle to perform this Christmas, and by God, we're going to do it.
Not even a goddamn miracle's gonna save this guy. He's jingled his last bells.
Yes, I realize that, Dr. Randall. Parathyroidectomy was not the correct treatment for mulibrainanism.
Indeed, it wasn't. And we must accept our mistake and find a suitable remedy immediately.
I've been doing some research on this, Randall. I believe if we administer regular doses of calcium supplements along with vitamin D, we could potentially reverse the symptoms of mulibrainanism.
Hannah, I really don't think there's any saving Santa.
That's a shame. We're just a few days shy of Christmas. There's got to be something we can do.
What in the world were you all thinking? I trusted you three with this case, but it seems like you've all completely forgotten what it means to be a diagnostic doctor. You nearly killed poor Santa due to your incompetence.
But Hawks, we thought we had it right. The symptoms pointed towards mulibrainanism, and the parathyroidectomy seemed to be the correct treatment.
And then suddenly you walked in here and accused us of making a terrible mistake. What's going on?
I have no idea what happened either, Hawks. We were sure we had the right diagnosis.
Mulibrainanism was not the diagnosis. It was a misdiagnosis, and parathyroidectomy is not the treatment for that patient. I'm warning you all, if you guys keep this up, your careers will be over.
We're so getting coal in our stockings if we don't come up with a solution fast.
Not even that, this town only uses clean energy now. The equivalent would be someone ripping a gnarly Dutch oven in your bed. Yuletide.
Okay, no one asked. What we need to figure out is what exactly put Santa in critical condition and work from there.
While you three slam your heads into each other until only one survives, I'm getting lunch.
Is Santa gonna pull through?
It's not looking like it. The guy really needs to learn how to operate a sleigh if he recovers.
He wasn't even operating it. I'm pretty sure I saw him fall from the sky after losing grip on an overhead jet.
His reindeer really let him down.
Would you put that much faith into plastic lawn decorations?
No, but this was no ordinary mall Santa. This was a daredevil performing stunts to reinforce the truth that Santa is real, and he is coming.
Given Christmas is just 6 days away, do you have any plans?
I'm gonna visit my family overseas. Maybe even propose to my long-term girlfriend.
You don't have family overseas, nor a girlfriend, unless you consider Tracy more than what we all know.
What you all know. Get your mind out of the gutter, you unprofessional slime. Look, I know you all think my methods are unconventional, but hear me out for a minute. Multibrain anism was not the correct diagnosis.
Hawks, you realize we're in an operating room, right? You're supposed to be wearing protective gear.
I know I'm not following standard procedure, but sometimes we need to think outside the box. I've been researching all day, and I believe I have found a new diagnosis for this patient's condition.
What is this new diagnosis?
How did you come up with it? You were at lunch, weren't you?
Yes, that's correct. And during my lunch break, I spoke to Johnson about the symptoms we've been observing. He suggested Tolosa-Hunt syndrome.
What are the implications of this diagnosis for our patient?
The prognosis is fairly good. With proper treatment and care, the patient should make a full recovery. The only issue is that Santa is in fact dead, right there on the operating table. I'm not even sure why you brought him in here.
The coroner is on holiday break, and we were curious whether his death was due to his injuries or your idiotic treatment plan.
This is just sad, folks. Christmas is ruined. In 6 days, millions of children will wake up to no presents because Santa was too stubborn to fly commercial, legally.
Hawks, I'm not even sure why you're still beating a dead horse over a fake belief in Santa. I've never met a Christmas charlatan before.
It's not fake. This was the real Santa Claus.
His real name was Bernie Thompson. Hawks. Just stop.
I really don't like how we have a hospital of atheists denying the existence of Santa right in front of them. Picture Tiny Tim coming in here crying and asking for an explanation for your blasphemy.
I literally cannot picture that, given he's been dead for nearly 30 years.
I'm talking about the Charles Dickens character, not Dollar Tree Geddy Lee with a ukulele. But if any child came in this room right now, how would you tell them this is not only a dead Santa, he's fake?
I've got it. You've heard of Elf on the Shelf. Now get ready for Bernie on the gurney.
Hannah, I'm going to go back to my office and inject stale eggnog directly into my veins. And I probably still won't kill as many brain cells as I've just lost listening to you. Yeah, for the past minute. It wouldn't even kill enough for me to get through another minute. All three of you deserve to freeze to death in the South Pole. Well, Tracy, it's not like I wanted to make a mistake with the diagnosis. It was just the way things went.
And it goes to show that even someone as experienced as you can still make mistakes.
Yeah, and if you had just agreed with my reasoning...
I know what you're going to say next, Hawks, but I think we should focus on learning from our mistakes instead of dwelling on them.
Learning from a mistake is fine, but not when that mistake can cost someone's life.
That's why we have protocols in place. And it's also the reason I insisted on getting a second opinion. It's crucial to always question your assumptions, Hawks.
You know, sometimes being too cautious hinders progress.
And sometimes being reckless leads to disaster. We need to strike that fine balance between caution and risk taking.